afternoon, all of you. Thank you for being part of this. Today's session that I'll take for the next 18 to 20 minutes, if every one of you really focus on what I would speak, this could be a game changer for your life, a game changer for the country, and a game changer for the world. I had opportunity to read out multiple things, share with you the data points, share with you multiple movements of AI blockchain analytics, but I thought that would be too heavy for you or the audience at large who would actually see it later. So I thought it's so much important for me to make sense of what I speak, because I'll speak on your behalf. I'll speak for the behalf of those people in India and the world who don't understand what is the meaning of health and sustainability for them, and also does not understand what is the meaning of pathways to a better tomorrow. Do you know why? Because most of the Indians, they really cannot afford healthcare. And when someone cannot afford healthcare, so for them the better tomorrow don't exist. It is the today that exists for them. Because either they have ailments, they have chronic disease like diabetes, gastro, peds, nephro, obs-gynae, etc., or they have a simple fever in their home where they cannot afford medicines for them. That is healthcare. But let me start with some basics. And whatever I speak today, I want you to not only understand and absorb, but take it back home and work for that. Only then the meaning for TEDx works. And then also the viewers who see this on screen later, if you only have meaning for it, then it works. Or else it does not work and is just a normal talk show. Here I start. Number one, what do you mean by health care? It means, and that I'll talk, is something that where you have health at your home and health out of your home. What does that mean? It means that when you go back home, do you have the right mental stability of health, or you don't have the right mental stability of health? As I speak now, I want all of you to focus, take notes wherever required. Only then you can make a change in your life, otherwise it will just be just a talk show. Only then you can understand how you can build a better country for India at a large, or else you will only say Mera Bharat Mahan, and it will never be Mahan for all of us. It means when you work on the mental stability, that is healthcare, along with physical stability. Most of the households that you see, there you have distortions of mental stability. That is the reason you find commotions at home. That is the reason you find quarrels at home. That is the reason you find lots and lots of difference of opinions at home, and that is where there's a complete distortion of the healthcare dilemma inside the home itself. My friends, here I have not even touched on physical healthcare, where the medicines comes in action or the other non-medicines wellness items comes into action. Here I'm only speaking about the mental health. Where is mental health for a woman, or for the women at home, or maybe your mothers, where they don't have freedom to do what they want to do? Where is mental health for them, where they have to beg money in front of their husbands? Where is healthcare, where they don't even know that if they want to build a great ecosystem of business or career for them, they are shunned and they undergo and get into a physical abuse? My friends, observe my statements, words carefully, for you to understand that the world at large is on a threat on domestic violence. And if you don't stand for that, then you are not only hypocrite by nature, you also do not showcase yourself to be a true individual in front of the mirror. The world at large is suffering a huge healthcare dilemma of mind and body. You don't understand because maybe you are not suffering it today. You would only understand when you are slapped at home by that male fraternity and told that you are deserved to be slapped at home. That is what I see. And that is called the domestic violence. And these domestic violences do not come out because that women at home cannot speak on that because of the societal issues, because they know that they have to stay there. That is distortion in healthcare. And any student, anyone who sees this, any fraternity who sees this and keeps mum, they are part of that ecosystem of distortions. Unless you, me, and the viewers work for every household that suffers the domestic violence, we can never build a sustainable healthcare. Forget about the global indexes that we show. Forget about the data points that we show. Forget about the government numbers that we show. Forget about the world ranking numbers that we show. It all starts at home. As they say, the charity begins at home, and that is called healthcare sustenance. If you don't understand that women at home need to be respected and women are not commodities, they can never ever, the country can never ever build healthcare. As I see, some of you don't understand the importance of this subject, and I said because you have not brutally been raped at home. Trust me, gentlemen, ladies, we find that under the so-called name of marriage, there's a brutal section of rape that goes inside the home with the so-called definition, the husband. That's called healthcare distortions. That's called non-sustainability of healthcare. And there is, where we are working against domestic violences, where we are working against physical abuse to women, where we are working against that sharing of respect towards the fraternity. And we are working intensively on this as a subject because we believe that this is the grave situation that we all are undergoing inside the houses, where physical assault is a critical paranomia, and this is not been taken out because the women at home feel that the society will make her a scapegoat and talk about a distortion about her itself and point that no, there's a problem with the woman and not with the man. There is the issue that we are facing, and we are talking big jargons of artificial intelligence. We are talking big jargons of blockchains. We are talking about GDP movements. We are talking about great stories of healthcare. As I always said, that unless you really, really build that ecosystem inside your home, you do not justify yourself even to understand that you are incapable and impotent towards saving a woman who is in the intense sense of pain that she is undergoing in the family. And as usual, there are always some casual people that lays there, because their life is all about casualness. And that is the reason they will probably never grow, neither will be part of the system or the eco-structure ever. Now I come to a much larger story, which is called physical distortion of healthcare and sustainability. India at large have innumerable chronic ailments, the world to have, but as of now I would spread and concentrate more on India in terms of cardio and diabetic. These two parameters is what I would speak about. Most of the households, barring the geriatric patients or the geriatric issues that they have, there are huge issues of diabetic stories that unfolds in the house. Now, what is it that we in the country need to do about that? Again, I say that it would only stay as a talk and it will not have outcome towards your 20 minutes that you would spend. But if you understand and if you're part of the ecosystem, then I would say that India at large need to really, really work about the entire diabetic story that is unfolding in India. It is becoming a huge, huge story where not only that, we find that every 1 in 10 patients is either a diabetic or a pre-diabetic non-diagnosed, which means that they have either not tested or they do not know that they are getting into a diabetes situation. What we have to do as a country is not only the story unfolding that we are doing to build diabetic campaigns, anti-diabetic stories, anti-diabetic drugs. That's just a reactive measure. What we need to do is we need to build an ecosystem that would free India once for all, at least to become a non-diabetic country or a non-diabetic progressive country. What does it mean and how will you do it? It's so much important to start the whole story with a 30-year cycle right from the onset, where you know that you are building an ecosystem towards freeing India for diabetic into the unfolding of the huge disaster that we are undergoing. It would start from the education systems, where we need to train our children when they are in Montessori's or class 1 or 2, that look, you cannot eat sweets. You cannot eat white sugar. You cannot use those sugar directly or in the form of any chocolates or sweets or similar, or those pastries and donuts. And it should start from there. If it starts from there, then you would understand that this would take a good 20 to 30 years for the country to get into a kind of semi-free diabetic zone. Because this would be the small boys and girls who would grow up into youngsters. From school they would go to college, and then they would go to universities. But by the time they are going, in their entire bloodstream of the ecosystem of the body, they would have very, very less direct sugars. Now this reduced direct sugars over a period of good 15 to 20 years would ensure that the next generation that is coming ahead in India is getting into a non-diabetic zone. And what do we achieve as a country? The current fear of India being the diabetic capital of the world would completely vanish off in the next 30 years' time when the new generation is coming out. And that would build a generation of non-diabetic India. And that is what is called healthcare sustainability. Healthcare sustainability does not mean that we talk on the data of how much we are spending in healthcare and what are the new healthcare attributes that comes. Healthcare sustainability means what is it that you should actually do to build a great healthcare story that would unfold to build an ecosystem of a great healthcare inside your home and get great healthcare outside the home. That is called sustainability. Similar, I can speak about gastro, nephro, peds, obs-gyne, or cardio. But with the span of time that has been allotted to me, I thought it's so much prudent to take up that point that not only have rung the alarm bell for all of us, but that point that actually moves each one of us. I have good 5 minutes to summarize, which I'll take the opportunity to re-emphasize my statement to ensure that you not only understand, but later the viewers who see this, they actually work on that. Because if you don't work on that, then maybe you would become the victim of this non-sustainable healthcare, of this crooked mind somewhere, sometime. And then you would feel that had I worked on that, had I thought that I would also be participative towards building a great healthcare ecosystem, then the country would have been better. To summarize, 1, any situation of non-healthcare sustainable, narcissist issues at home, toxic cultures of healthcare at home need to be spoken about and need to be flagged up. When you see that in your locality, you have a woman who is stressed out, who is beaten, who is undergoing physical assault, that is the clear sign that the men at home is in distorted mental calibrated mind because they have the audacity to raise the hands on a woman. That is a negative healthcare at home itself. What do we talk about healthcare at large when you have negative healthcare at home? There is where if each one of you stand in your own locality and become the true leader in your own locality, become the CEO for your own locality, you will see that we not only build a great healthcare for your locality, and in turn a compounded story, we build a great healthcare of the country. And those women who undergoes this mental trauma, physical trauma of someone really slapping them off, someone really beating them hard, and undergo this daily basis, this mental and physical abuse, at least some of you, if you listen to me, understand and feel that, then you can stop that. If not, at least you can look up to your own eyes and say, I tried. But unfortunately, most of them, or most of the people, love to see when it's someone else's problems. You only react when it's your own problem. You only feel that pain when your mother is physically abused. You only feel the pain when your sister is physically abused, probably if you have mind. And if still not, you don't have the pain, then unfortunately maybe you really need some good charge up in your mental mind. That's called healthcare sustainability. If we do not do that, we are ending up in the next 30, 40, 50 years to build an ecosystem of negative stories inside the home with a huge mental trauma that women will undergo. And why I say that is because, since you're working on this, we see the kind of agony, the pain that women actually undergo, the kind of mental trauma that they undergo when they actually see. And for the sake of your understanding and that, my words penetrate your heart and blood, I'm trying to re-emphasize every single time on this so that you understand. If you don't understand, then at least, you be part of this story where you can save someone who is at pain. That is called sustainability. And at large, if we talk about sustainability, I also spoke about the other point, that go back to the schools, wherever you have studied, go back and meet your principals and teachers and tell them that even if the government does not change the syllabus, even if the education ministry do not change the syllabus, in school, why can't you start that in tiffin boxes, no sweets? In school, why can't you start that in the tiffin boxes, no donuts? In school, why can't we start that from Montessori, KG till class 10? Do not allow or incentivize those parents or those students who would be going as sugar-free. No sugar. I don't mean that you should consume sugar-free as a product. No sugar. No sweets. If you don't do it, why are you even listening to it? I don't prefer someone listening and not acting on it. So there is, where you work towards building a better society. You know your school better. You know your colleges better. If each one of us goes to few of the schools and try to do it, maybe some of them agree. That's your win. If you don't try, then you don't win. There's a definition in physics, work is equal to force into acceleration. Give that force, acceleration will happen. And there is, where we build a great country where healthcare will be sustainable. There is where we build a story where you will feel proud about it. There is where we build a story of ecosystem where our homes would be better, where our country would be better, and healthcare at a large not only becomes sustainable, but we actually get a better tomorrow, not today, tomorrow, day after tomorrow and all, and each one of you are contributor for the better tomorrow. Thank you so much for listening.